Does the time of day affect immunotherapy outcomes in cancer? So, this is a subject that's gaining a lot of momentum in the medical literature, in the medical databases. And they've been looking at all kinds of cancers. So there's been large emphasis on solid mass tumors such as, lung cancer, melanoma, renal cell cancers, gastric cancers, etc. But what their people have been looking at is the timing of day. So earlier use of immunotherapy in the day versus later in the day, in the afternoon, right, for example. And they've been linking with outcomes, so survival. And the data has been suggesting that earlier administration of immunotherapy, and by that I mean the classic checkpoint inhibitors such as Optivo, Keytruda, etc., there could be a difference versus receiving it later in the day. And when they're looking at the timing of this, it's kind of been all over the map when I was looking at it. So some data has suggested 11:30 in the morning is a cutoff, so earlier than 11:30 versus later. Some have suggested 4 o'clock p.m. in the afternoon, earlier versus later. Well, what's interesting, presented at ASCO, the American Society of Clinical Oncology, was the first randomized trial looking at this in advanced lung cancer, a study from China. And their cutoff of administration was 3 o'clock p.m. in the afternoon. So basically that the immunotherapy was finished before 3 p.m. or continued after 3 p.m. And when you're looking at the data that was presented, it looked quite impressive. Basically, the cancer treatments being much more profound and impactful in the people who've received the immunotherapy before 3 p.m. versus after 3 p.m. This has definitely created a lot of discussions regarding something as simple and cheap as just changing the timing and how this can potentially impact the immune system and its response to cancer. However, when you look at some of the traditional medicines in this area of circadian rhythms and the biorhythms of the body, it's nothing new in those areas. Traditional Chinese medicine has always historically talked about rhythms and organ systems for like hundreds and thousands of years. So they have a 24-hour organ meridian clock where different organ systems have different dominance of different time of the day. So for example, the spleen meridian is most active during 9 a.m. and 11 a.m. In conventional Western medicine, the spleen is known as this immune system organ. In traditional Chinese medicine, it has this thing of generating qi, life force, blood, these vital components. So remember, this was prior to, their understandings of the immune system, of adoptive, innate T cells, and all the rest. So anyway, this trial tends to open that doorway of discussion of the immune system, circadian rhythms, and cancer. And then obviously this also creates discussions with centers who are administering immunotherapy medications and timing. So this could put potential strains on systems. So here in British Columbia, when we know there's already some stressors in the oncology system, but if you're a patient that's like, well, I want every best value of receiving this immunotherapy, even though while the data continues to evolve, can you deny patients that? And so obviously this is an important area and more to learn, but nonetheless quite interesting.